Naproxen is a nonsteroidal anti-inflammatory drug NSAID that is commonly used for its analgesic, pain-relieving, anti-inflammatory, and antipyretic fever-reducing properties. Naproxen primarily works by inhibiting cyclooxygenase COX enzymes, specifically COX1 and COX2. These enzymes are involved in the production of prostaglandins, which are responsible for pain, inflammation, and fever. By blocking COX enzymes, naproxen reduces the synthesis of prostaglandins, leading to pain relief and reduced inflammation. Naproxen's inhibition of COX2 is responsible for its anti-inflammatory effects. By reducing the production of inflammatory prostaglandins, it helps alleviate inflammation associated with conditions like arthritis. Naproxen's pain-relieving effects are attributed to its ability to block COX1 and COX2, which reduces the sensitivity of pain receptors and decreases pain perception. By lowering prostaglandin production in the brain's hypothalamus, naproxen can lower fever by resetting the body's temperature-regulating center. Naproxen, like other NSAIDs, can affect platelet function and inhibit blood clotting, which may increase the risk of bleeding. This is why it's important to use naproxen with caution, especially in individuals with a history of bleeding disorders. The recommended dosage of naproxen can vary depending on the condition being treated. Typically, for pain relief or inflammation, the initial dose is 250 mg to 500 mg, followed by 250 mg every 6 to 8 hours as needed. Naproxen can help manage pain and inflammation in conditions like osteoarthritis and rheumatoid arthritis. Musculoskeletal pain. It is often used to alleviate pain related to muscle strains, sprains, and other musculoskeletal injuries. Naproxen can be effective in reducing the pain and discomfort associated with menstrual cramps, dysmenorrhea. It is sometimes used to treat tension headaches or migraines, although other medications are more commonly prescribed for migraines. Naproxen may be prescribed for dental pain or after dental procedures to reduce inflammation and pain. It can also be used for pain relief in various other conditions, such as bursitis, tendinitis, and gout. Side effects. Upset stomach. This may include symptoms like indigestion, heartburn, nausea, and stomach pain. Taking naproxen with food or milk can help reduce stomach irritation. Gastrointestinal issues, NSAIDs, including naproxen, can sometimes lead to more severe gastrointestinal problems such as ulcers, bleeding, or perforation of the stomach or intestines. These are less common but more serious side effects. Headache. Some individuals may experience headaches as a side effect. Dizziness or drowsiness. In some cases, naproxen can cause dizziness or drowsiness, so it's essential to use caution when operating machinery or driving if you experience these symptoms. Fluid retention. NSAIDs like naproxen can lead to fluid retention, which might cause swelling, particularly in the ankles and legs. High blood pressure. Prolonged use of NSAIDs can sometimes elevate blood pressure, which may require monitoring by a healthcare professional. Allergic reactions. While rare, some individuals may experience allergic reactions to naproxen, such as skin rashes, itching, swelling, or difficulty breathing. Kidney function changes. Naproxen can affect kidney function, which is more likely in individuals with pre-existing kidney problems or those taking certain medications. Some common interactions and substances to be cautious of when taking naproxen include other NSAIDs. Using multiple NSAIDs such as ibuprofen simultaneously can increase the risk of gastrointestinal bleeding and other adverse effects. Avoid combining NSAIDs unless specifically instructed by your healthcare provider. Aspirin. Naproxen may interfere with the antiplatelet effects of low-dose aspirin when used for cardiovascular protection. If you are taking low-dose aspirin for heart health, consult your doctor before using naproxen. Blood thinners. Naproxen can increase the risk of bleeding when taken with anticoagulants or antiplatelet drugs, Like warfarin or clopidogrel, close monitoring and dosage adjustments may be necessary. Steroids. Combining naproxen with corticosteroids can increase the risk of gastrointestinal ulcers and bleeding. Blood pressure medications. Naproxen can reduce the effectiveness of certain antihypertensive medications, potentially leading to elevated blood pressure.